Welcome to the Ontario Basketball Association's Orientation to Concussions in Youth Basketball for OBA Officials, brought to you in partnership with the Concussion Centre of Holland Bloorview Kids Rehabilitation Hospital. This video is for all new Ontario basketball officials. Today, we will broadly cover important information about concussion in youth and your role in preventing, identifying, and reporting suspected concussions as an official for Ontario basketball. The Holland Bloorview Concussion Centre is a trusted voice on youth concussion, with clinicians specifically trained in pediatric brain injury and leading researchers in the field of youth concussion. The Concussion Centre is backed by Canada's largest pediatric rehabilitation hospital, a teaching hospital fully affiliated with the University of Toronto, and has worked with many local and provincial organizations and national agencies to bring concussion awareness, education, training, and safety to children and youth in schools and sports. In 2017, Holland Bloorview and Ontario Basketball entered into a formal partnership with the goal of enhancing player safety on and off the court through implementation of a comprehensive concussion strategy in youth basketball. This includes education and training for the Ontario basketball community, access to care for players, policy and protocol development for the organization, and participation in research. This video was created in 2018 to begin meeting the requirements of Rowans Law, new legislation in Ontario intended to protect amateur athletes by improving concussion safety on the court and at school. Officials have a key role on the court to monitor safe, fair play and make calls to stop dangerous play, so this is a great fit. As Rowans Law develops, the partnership will be crucial in updating education, training, policy, and protocols for concussion management to the Ontario basketball community. Youth sport participation has undeniable health benefits, but with any physical activity, there are some inherent risks of injury. Research conducted in the province of Ontario has reported that the number of concussions seen in emergency departments and physicians' offices acquired by children and youth from all causes has continued to grow in size over the past decade. More data from the U.S. reported the incidence of traumatic brain injuries acquired by children and adolescents from specifically basketball participation, including concussion, increased by 70% over 10 years between 1997 to 2007. These scientific studies and many other point to an increasing number of concussion injuries among a younger population. This growing collection of research has directed efforts to increase awareness, education, and recognition of youth concussions. Ultimately, we want for kids with suspected concussions and their families to be quickly directed to the right resources from people with the right information so they can get the help they need and return to the activities they love to do. In order to recognize a concussion, we need some understanding of how concussions occur and what happens to the body. A concussion is a brain injury, first and foremost. This visual helps us to see if a person takes a blow to the head or another part of the body. This blow can cause the brain to move rapidly inside the skull, and this rapid movement can cause the brain to make a forceful contact with the interior of the skull or create forceful rotation of the brain, and these mechanisms can cause a concussion. In this infographic, the signs and symptoms of concussion are presented in 4 categories: physical, mental, or cognitive, sleep, and emotional and behavioral. By signs, we mean stuff that can be detected by someone else, and by symptoms, we mean stuff that is experienced by the injured individual. Some of these are signs and symptoms. As an official with eyes on players during a game, you may not come across sleep signs of concussion. Mental signs and emotional or behavioral signs may also be hard for you to detect from a youth you do not know well. However, it is important to know that there are more than just physical signs and symptoms to concussion, because an injured player could report any of these symptoms to you, and reporting symptoms after a mechanism of injury is enough to suspect a concussion. We will go over an example of this later in the video. Let's look more closely at each category. The physical signs and symptoms of concussion are headache, nausea, dizziness, sensitivity to light, sensitivity to noise, vomiting, vision problems, balance problems, and numbness or tingling. The mental and cognitive signs and symptoms are feeling mentally foggy, feeling slowed down, difficulty concentrating, difficulty remembering. These symptoms may appear to others as answering questions more slowly than usual, for example, or getting confused with directions or tasks. The emotional and behavioral signs and symptoms of concussion are irritable, nervous or anxious, frustration, anger, or sadness. Here we are talking about emotions and behavior demonstrated by an individual in a way that's more than their usual. These signs and symptoms can be more subtle and hard to notice, but should be taken as seriously as all other signs and symptoms. These are the sleep signs and symptoms of concussion: drowsiness, sleeping more or less than usual, trouble falling asleep and staying asleep, and fatigue. Part of the stigma people with concussion face is that the signs and symptoms of concussion are often difficult for others to see and accept, but they may have a significant impact on a person's daily life. The injury to the brain is not visible like a broken or bruised body part. Furthermore, we cannot provide an accurate prediction of when someone will recover from their concussion, as every injury is different between people and even between incidences of concussion for one person. Here are some important facts about signs and symptoms of concussion to keep in mind. As we just heard, every concussion is different. The way that a person sustains a concussion, experiences symptoms, and moves through recovery is individual. Signs and symptoms of a concussion may occur right after a blow to the body, but may take up to 48 hours to appear. Where at least one symptom of concussion is reported after a blow to the head or another part of the body, that is enough to suspect a concussion and should be treated seriously. We cannot detect concussions from modern medical imaging, like a CT scan or MRI, so assessments by physicians and nurse practitioners must rely on how someone acts and feels. If a suspected concussion is brought to the attention, the injured person should be further assessed by a physician or nurse practitioner in an appropriate environment. Sideline assessments are not appropriate. In your role as a sport official, there are a few ways in which signs and symptoms of concussion may be brought to your attention. Self-report means that an injured player speaks for themselves and tells you how they are feeling. Observed means that you have seen signs of concussion in a player after an event that may have caused injury. When signs and symptoms are peer-reported, this means that someone else, like a coach, a parent, or another player, brings to your attention the way a player is feeling or acting. All of these are valid ways of receiving information about an injured player that can lead to a suspected concussion. Remember that if at least one sign or symptom is reported in any of these ways after an injury event, that is enough to suspect a concussion. There are some other signs and symptoms that we need to talk about for safety. If an individual presents with any of these red flag signs and symptoms, you should stop gameplay and immediately tell someone who can call 911 right away. These signs and symptoms may be indicators of other types of trauma or brain injury occurring that need emergency medical attention. It is recommended that any child with a suspected concussion sees a medical doctor or nurse practitioner as soon as possible in the ER, a walk-in clinic, or a family doctor's practice. It is important to receive medical assessment because we want to rule out a more severe brain injury, obtain proper diagnosis, and receive this medical note for a concussion diagnosis to support the return to school and sport accommodations. It's important to remember to call 911 or go to the ER immediately if red flag symptoms are present. It's also important to remember that we choose a medical doctor or nurse practitioner because they are considered the only qualified professionals to rule out a more severe brain injury and best practice as laid out by the National Guidelines on Concussion. In this section, we would like to introduce you to Bill 193, Rowans Law, Concussion Safety. Rowans Law was passed in Ontario on March 7, 2018. This legislation began in memory of Rowan Stringer, a 17-year-old rugby player from the Ottawa Valley, with the goal of bringing awareness to concussions and concussion safety. This law is intended to protect amateur athletes by improving concussion safety across sports and at school. Under Rowans Law, there are requirements for sport organizations that will directly impact your role as an official. For more information on Rowans Law, check the Ontario Ministry of Tourism, Culture and Sports website. Here are some highlights of the requirements within Rowans Law, Bill 193, that will be imposed on sports organizations. As a sport official, the first important step to adhering by Rowans Law is to review concussion awareness resources. Reviewing the information in this video is an example of meeting this requirement, but be sure to stay tuned to new and more in-depth information about your responsibilities for concussion safety from Ontario Basketball and the Ontario government. Across sports organizations and schools in this province, concussion management is understood to be important to the health and safety of children and youth. As such, organizations like Ontario Basketball have begun to outline the necessary actions that should be taken by people involved in the game that would support child and youth players with suspected concussions. It's important for you to know that supporting a child or youth with a suspected concussion is a team effort. For a child in sport, this means concussion management involves the player, their family, teammates, coaches, trainers, game officials, and the sport organization. Everyone has a role in supporting a child or youth with a suspected concussion. Here, we outlined how you should support safety and concussion management on the court in your role as a sport official with Ontario Basketball. Firstly, be aware of concussion signs and symptoms so you have a better chance of recognizing them in a game situation. During a game, if signs or symptoms of a concussion are brought to your attention in any of the 3 ways we discussed earlier in this video, such as self-report, peer report, or by your own observation, it's in the best interest of a child's health and safety to treat these reports and observations seriously. Talk with the player or players involved and do your best to recognize A, if there was an impact or physical force to a player's body or head, and B, any signs or symptoms of concussion that followed. Game officials should encourage players to speak honestly about how they feel at any point following an impact to the head or body. Keep in mind, some children and youth may find it difficult to put into words what they are feeling right away, or they may not have any signs or symptoms of a concussion for some time later. These types of delays should not discount the possibility of a concussion. If there was an impact or force to a player's head or body, and any signs or symptoms of concussion that followed, that is significant enough to suspect that a player may have a concussion. If you suspect a player may have a concussion, report what information you have to that player's coach or coaches. The key here is initiating a team approach to monitor a suspected concussion. You can responsibly pass on information to someone who can follow up with the player beyond the game. Coaches are in a good position to do this, and they are easily accessible to you on the court. Also recommend to any players with a suspected concussion that they seek medical attention by a medical doctor or a nurse practitioner as soon as possible. Again, you should not be the only personnel on the court or sidelines to recommend this, but it can't be said enough. Medical assessment by a medical doctor or a nurse practitioner in the appropriate setting is very important in order to rule out more serious conditions and to diagnose a concussion. Finally, know that by reporting suspected concussions to coaches, this should facilitate removal from play, which helps protect a child or youth's developing brain with a concussion from the risk of re-injury or prolonged symptoms. In summary, recognize how concussions happen and the signs and symptoms after injury, report suspected concussions to coaching staff, know that all players with a suspected concussion should be removed from play, and recommend kids with suspected concussions seek medical attention as soon as possible. Finally, be sure to stay up to date on Ontario Basketball's policies on reporting injuries, including suspected concussions. Let's tie in what we've reviewed today by going through a few scenarios. Read carefully and decide what actions you would take as an official on the court. Hit pause on your screen to spend more time reading or thinking about the actions you would take. A player is driving towards the net for a layup when he suddenly collides with a defensive player and falls backwards to the ground. The player that has fallen slowly gets up from the ground, looking somewhat out of it and off balance. There are some key things to recognize about this scenario. Let's look at those. Very simply, the official in this scenario witnessed a player involved in a collision with impact to the body, and this was followed by observations of that player with physical signs of a concussion. This combination of a collision and signs of a concussion is enough to suspect that this player could have a concussion. Immediately after observing this is the right time to take action. What should you do? To begin, you can approach the player and ask how they are feeling. If appropriate, stop gameplay as well. Whether the player reports feeling fine or not, it is equally important to report the incident to the player's coach because symptoms of a concussion may appear later on or worsen. In either case, once a suspected concussion is reported to a coach, that should facilitate removing a player from a game in the interest of the player's health and safety. Medical assessment is needed to confirm a concussion, and until a player seeks immediate medical attention following an incident like this, Returning to the game is not recommended because the risk of an injured brain being hit again is a serious cause for concern that could delay recovery and prolong and worsen symptoms. If you suspect a player has a concussion, you should recommend that the player stop playing and seek medical assessment right away. Let's review another game scenario. A player goes up for a rebound and comes down with an elbow to another player's head. The player hit in the head with the other player's elbow continues to play the game. In this scenario, it's important to recognize that a player was hit in the head but did not show signs or report symptoms associated with a concussion. Because there were no observed signs or reported symptoms of concussion, there is not enough in this case to suspect the player could have a concussion. However, signs and symptoms of a concussion can appear 24 to 48 hours after an impact to the head or body, so sharing this message to players, coaches, families, and the general public is important education to monitor youth at risk. We have talked a lot about what happens after a concussion, but are concussions preventable? The answer is twofold. Unfortunately, any player can sustain a concussion. However, there are strategies that can help reduce a player's risk of a concussion. Officials should focus on rule enforcement as a concussion prevention strategy. Officials have eyes on the game at all times and are responsible for helping prevent dangerous play and unsafe behavior that could result in concussions. Playing the game safely requires technique that is a learned skill and mostly reviewed by a coach. It is a myth that special equipment can prevent concussions. No equipment on the market can 100% prevent a concussion. Additionally, some players wearing equipment marketed as concussion-proof may engage in more risky behavior. In summary, these are the 4 points that we want you to take home. Know how concussions happen and the signs and symptoms. Signs and symptoms can be physical, mental or cognitive, behavioral or emotional, or to do with sleep after a blow to the head or body, and may appear right away to 48 hours later. Stop and report suspected concussions to coaches immediately. Stopping dangerous play and reporting suspected concussions are important actions in promoting early recovery for players with concussions. Not solely responsible, officials are part of the team. Awareness, education, and training on concussions across all Ontario basketball programs to all involved. We are all part of a team effort to keep players safe and in the game. Stay up to date with your organization's concussion protocols and policies. Concussion Code of Conduct and Remove from Play protocols will be developed and updated over time. There are risks that come with participating in sport, but when everyone does their part to make safety a priority, we see the benefits outweigh the mitigated risk. To learn more about concussions or to refresh your knowledge from today, check out www.hollandbloorview.ca/concussion. Thank you very much for your time.